Hello, everybody. Dr. F. Scott Field here, and I'd like to introduce you to our newest sponsor. The NPTE Final Frontier is the review course that I wish was around when I took the board exam. For those of you who know my story, it took me a handful of times to pass that exam, and quite frankly, I really wish I had an exam review course around, just like the NPTE Final Frontier. Check out their website, npteff.com, and use the code HET at checkout for 10% off to all of our listeners and fans. Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with me a phenomenal guest today, Dr. Jamie Dyson. Jamie, thanks so much for coming on today. We're going to talk about something on everybody's mind, and that's the student loan debt crisis. But first off, tell our audience a little bit about who you are and your academic journey and how it's kind of led you to where you're at today.
Thanks, Scott, and thank you for having me on today. My journey started, I've been a PT for just over 30 years. I graduated from Northeastern University in Boston and moved down to Florida in 1992 and have been practicing primarily in the acute care setting with a specialization in critical care, polytrauma, and burns. And for the past 20 years or so, I've also been involved in education as an adjunct instructor. I also teach a lot of continuing education courses on critical care, physical therapy, acute care, physical therapy, as well as clinical education models. I actually helped write a couple of chapters in a clinical education textbook, and I've written a few chapters in cardiopulmonary physical therapy textbooks. I've also been a part of helping to author the resource for vital signs for the Academy of Acute Care and the Academy of Cardiopulmonary and Vascular Physical Therapy, as well as the lab value resource for the Academy of Acute Care Physical Therapy. But student debt is a huge deal, and I'm happy to answer any questions I can.
Yeah, I mean, you've done it all. You have literally done it all, my friend. And that's why I love having people like you on, because I learn along the way, and I hope our audience does as well. But let's start with the very basics here, right? Let's just start with student loans in general, right? Overall, a lot of people that go to college take out student loans, right? Some may not, but most people do. Then as you go to grad school, it seems to become an even more pressing need, right? Because now you're seeking further education and may need more money, right? And more student loans. How do you think overall we're doing as just a society in educating our young people as far as high school, even as far back as high school, on what student loans are and how they work, and whether or not they should take them and what their impact may be?
Yeah, I think there's been a big change in culture as far as the use of student loans from when I was a when I was a student. When I did my undergrad degree, it was normal, and probably 80% anecdotally in my class were also working aside from going to school. And I did a bachelorette in physical therapy initially, so I was in PT school and during my bachelor's education. But probably 80% of the class was working in some way, shape, or form. And I was actually working up to 40 hours a week, aside from going to PT school. So yes, I did take out some student loans, but the amount that I ended up having to take out wasn't as much. It wasn't nearly as much as what I'm hearing folks are graduating with just from their bachelor's degree. Forget about grad school at this point. And that helped me immensely. So once I graduated and started working, I didn't have this overwhelming debt. And I had come to living with this lifestyle of sharing a room and ramen noodles and everything you did as a college student to save money. And, I didn't immediately change that lifestyle. Of course, as my career progressed, I went from ramen noodles to, something a little bit better to eat, and, bigger houses and bigger cars and so forth. But it came gradually. I think the mindset is, okay, I've graduated. I want it all immediately. And you kind of have to flex into that. You have to slowly move into this because you do have this overwhelming debt. And unfortunately, I'm seeing graduate students now that can't afford to buy a house, and they're putting off having children. They're putting off, these lifestyle, these family choices because of this overwhelming student debt that they've gotten for themselves. And it's heartbreaking to see it, because we were in such a different position when I graduated. And it's heartbreaking to see the amount of debt that students are graduating with.
Yeah, I was kind of in that in-between phase between bachelor's and doctorate. I graduated when it was a master's program, but I was offered the transitional doctorate my first year after I graduated if I stayed around at ECU for another year, which I did, but then I didn't finish it. Life kind of got in the way, and then I had to eventually end up finishing my transitional doctorate through University of St. Augustine. So, and then I ended up getting my EDD through St. Augustine as well.
Mm-hmm.
So my story, and I'm open and honest about it, I ended up with a private school for undergrad at Wake Forest, right, which was pretty pricey. My parents helped out a good amount, but I still had to take out loans. Then a state school for PT school as a master's, and I did work throughout that time, which was pretty good because I was able to pretty much pay off all of my master's degree while I was working in school. But then the transitional doctorate and EDD, I had to take more loans out again because, again, another private university, and it was, just didn't line up. I was working full time while I went for my EDD, actually, and my transitional DPT, but, I was just taking little classes here and there one at a time. So it wasn't as big of a deal. But I ended up graduating with $140,000 worth of student loan debt and 2 doctoral degrees, a master's degree, and a bachelor's degree. So not bad, not great.
Not bad,
right?
no.
But we look at today's students, and it is like crippling amounts. I'm hearing students come out at 100,000, 150,000, 200,000. I've even seen as high as $250,000 to $275,000 worth of student loan debt to come out with a doctor in physical therapy, right? A doctorate in physical therapy. Now we have the bigger question, and it's really starting to turn some heads and shake things up a little. Is physical therapy still a worthy profession if you're graduating with that high amount of student loan debt?
Yeah, I absolutely believe that physical therapy is a worthwhile profession. The problem with us is we need to get better organized. Okay, you look at other doctoring professions, such as a medical doctor, they come out with similar loan debt, but because of the reimbursement for what they do and what they provide, they're able to offset those high student loans because their salaries are going to be at a higher level. Unfortunately, physical therapy isn't there yet. We have a lot of work to do. Reimbursement isn't what it should be. If you look at, there's really 2 sides to this equation. There's this cost to become a physical therapist, and then the reimbursement, and it's kind of on a scale. And right now the scales are leaning heavily towards the cost to become a physical therapist versus the reimbursement. So to balance the scales, we either need to decrease the costs of becoming a physical therapist or increase the revenue that folks can achieve once they graduate. With schools, if they have a cohort of 40 students and they're having 900 applicants for those 40 seats, it's going to be very hard to convince an academic institution to decrease the cost. I really don't think that's a formidable strategy to deal with this. Yes, some education to the students to not take out as much student loans. Is there ways around taking out as much? Yes, they're going to need the student loans, but can they avoid, these astronomical amounts? And, just getting some simple information. So what's the cost of living for the city I'm going to be living in when I attend PT school? You may get into 2 different PT schools, both CAPTE accredited, both probably about the same cost of tuition. But if the cost of living in one city is way more than the cost of living in a second city, well, you may want to take a look at that other city that may not have that heavy cost of living. So in the long run, that's going to decrease the amount of loans you're going to have to take out just for your your everyday living expenses. But on the other side, as a profession, we still have this huge variance in what it is that we do, these huge variance in how we treat even similar diagnoses. So because of that, our reimbursement just is not there, and it doesn't match our education. We need to focus on our being primary care providers and getting reimbursed at that level, same as a physician, same as a nurse practitioner, where you can start to see this offset in the cost to become versus the cost to be. The reimbursement we can receive when we do graduate from these programs. And that's going to take all hands on deck. I was just up in DC with APTA, and we were advocating for to reducing some of the Medicare cuts that are coming down the pike in 2023. And again, we're already not getting reimbursed enough, and now they want to cut it even more.
Never
And
ends.
the there was about 100 of us there, but there are there's 100,000 APTA members, and I don't even know how many PTs there are across the country. So we have less than 1% of the profession, advocating for what every single licensed physical therapist should be advocating for with their legislators. And we have to start with the big dog. The big dog is Medicare. If we can get Medicare to reimburse at higher rates, then we can start to work at the smaller and the local insurance providers to reimburse at higher levels as well. And in the long run, we have to show them that we decrease their costs. Yes, you may be reimbursing us more, but in the long run, you're going to be saving money because your patients won't be falling and breaking a leg, or they won't be disabled because of their back pain, or they'll be able to participate in society and not, be a burden on their family, et cetera. We all know what PT does. I don't have to go through that laundry list, but we have to show these insurance providers that what it is that we do will save them money in the long run. Everything from, in hospital care, we're decreasing hospital length of stay, we're decreasing readmissions to the hospital. On the inpatient rehab side, we're getting patients back to society, back working again. Same thing with outpatient. We're getting folks, back into the workforce, back to providing to their families. And even in the geriatric population, we're preventing falls, we're preventing other comorbidities from taking over and requiring more hospital care or more care, which is going to cost the providers even more money. So we need all hands on deck.
Yeah, you brought up a lot of really good points there. I mean, we start with the debt to income ratio, right? If you're graduating school, with $150,000 worth of student loan debt and you're making as a new grad $100,000, that's a really good salary right out of the gate. But when you look at the ratio, it's not great. Mm-hmm. And I promise you, not every new grad is making $100,000 right out of the gate. It's very setting dependent, very city dependent. There's a whole lot of variables that go into that as well. But yeah, I mean, I personally have not seen the reimbursement levels go up in my 15 years, 16 years as a clinician. I would love to see it make that trend and turn around. But like you said, it's going to take all hands on deck to get that moving in the right direction. And if we can get Medicare on board, then again, like you said, all the other insurance follow suit, hopefully. But I think there's a couple of interesting aspects that are happening nowadays too because of all this. Some good, some bad, and one of them I think is the issue of transparency, right? There's transparency in the hospital systems and having to show everybody what it costs for procedures and things, right? There's like the No Surprises Act where people are having to see what their medical costs are going to be, so they're not slapped with some ridiculous bill at the end, right? Then there's also this push for now schools and universities to show what it costs to become a PT, right? To make it a fair playing ground for everybody to see what's going on, and truth be told, I think a lot of employers are even being a little more open too, as well as employees, about salaries and about what they're making in certain areas and certain settings. I think it's just becoming a more transparent world because it kind of has to be. Would you agree with that?
I absolutely agree. And, there's works in the process of, each CAPTE accredited program being transparent with their costs. And it's not just the cost of tuition. They're going to have to share costs on, what is an average apartment rental in the area, and, what are the taxes like in this particular part of the country. And because those are going to vary, from state to state, from city to city. We all know the cost of living is very different depending on where you live. And I think that plays a huge role in, the amount of loans that students are going to have to take out, because they have to eat, they have to live somewhere. And so that's all going to be rolled into that overall debt ratio when they do graduate. So I think that's going to be super important, and let the consumer decide if they're willing to, okay, I'm going to have to take out this much, loans. And, with that transparency saying the average student takes out $130,000 in loans, the student will then know, okay, I'm going to need to take out $130,000 in loans. Do I really want to do that? Or do I want to go to this other PT program where the average is $80,000 in loans? To me, it would be a no-brainer. I would go to, obviously, to the lower cost, but that's how my mind thinks. Others may not think that way. But when I was going through school, I was always trying to save a buck. I always bought the used books. I always bought, did everything I can to save. I had, I was in a 2-bedroom apartment with 3 other roommates. There was 2 of us in each bedroom with 1 bathroom, and that's how we had to live. I was in Boston. It was, pretty expensive to have an apartment there. So that's, what we had to do to live and survive and get our degree, knowing that after we got that degree, life would be better. And unfortunately now, for a lot of graduates, they're still living in that college apartment that they had when they were in school, and they're staying there because they can't really afford, due to those overwhelming debts, to purchase a place or get a better rental.
Yeah, I think, the unfortunate thing of that we kind of alluded to earlier is that it is affecting life decisions, like purchasing a house, like starting a family, like purchasing a car, right? Big decisions that should be, relatively easy when it comes to, like, I have a career and I'm making money, to, like, well, no, I think I got to put that off still because my student loans are so astronomically high. I can't afford to do that yet. And it almost doesn't seem fair when you have somebody with a doctoral degree in a career working, and yet, their credit scores may not be high, or the amount of money that they make to what they owe isn't lining up right to then go in and purchase a house. And it's like, well, that's one of the next steps of life. That's one of the next phases of life. And if they want to do that, they've got a career. They should be able to, afford a mortgage. And unfortunately, nowadays, it's a lot tougher to do. So the time period alone from when you and I went to school to where we're at now is like night and day. It's not even the same language.
Absolutely. And unfortunately, a lot of newer graduates are taking on that second job, that moonlighting job, to make up for this. So they're working 60 hours or more hours per week. So they're not getting that quality of life that, again, when they went into PT school thinking, yeah, I'm gonna help people and I'm gonna have a great life. And well, now I'm working 60 hours a week, and with all those extra hours comes the burnout. We're seeing a lot of burnout in folks. People 5 years into their careers are burning out because they're having to work so much to cover, that overwhelming stress of this overwhelming debt that they're graduating with. The bubble's got to burst at some point. We definitely need to start working on this and educating. I think it all starts first off with educating students as they enter PT school,
It's
or
got to
even
happen before that. Yeah,
or even
sure.
before that, on smart fiscal management, and so that they can manage their funding as they go through both undergrad and grad school,
Yeah.
so that they aren't graduating with this overwhelming debt. We're not going to be able to change the tuition costs. I don't see that happening. Reimbursement, yeah, that's a great way to work on things, but we also have to, let's not get into as much debt in the first place. Start that education earlier. Yes, maybe you should work while you're in that undergraduate degree, and decrease your debt loan amount. And so when you do go to grad school, you may not have that $50,000 to $60,000 in debt from their undergraduate degree that a lot of folks have. Then tapping on top of that their graduate loans. And that's where you're getting into these $200,000 combined loan debt, which is just crippling our next generation of physical therapists.
Yeah, I mean, we had a guest on a couple months ago who had done what I wish I had done in hindsight, and I'm preaching to my kids, and I hope that they'll listen, right? I feel like when I was in school, I worked really hard in high school to get the best grades I could, to excel, to try to get into the best college that I could, to then try to get the best job that I could. I don't feel like I was sold the lie per se on college. It really was a little bit of misleading if you look at it that way. But I did. Applied to a bunch of great schools. I only got into Wake Forest, so that was where I ended up going. I could have easily stayed in SUNY, it's and the State University of New York schools. I didn't want to. It was cold. The winters were brutal. Prices were high. I wanted out. I wanted to go south, so I did. But in hindsight, what I wish I had done, and what this guest had done as well, was community college for 2 years, state school for 2 years to finish my undergrad, and then probably state school for grad school. However, at that point, I probably could have afforded any grad program because I would have saved so much by going to community college and state schools. So I wish I had done that. I'm preaching to my kids. I hope they'll listen. I don't know.
Yeah. And, back in when PT was a bachelorette degree, I was a senior in high school, then I was a first year DPT, not a first year PT, not a DPT student, but a first year PT student. And man, talk about culture shock. That senior year of high school is pretty easy. And then you go into that first year where they open the fire hose and you kind of learn from your mistakes. But in high school, I had always worked and I'd always been taught to save money. And so I saved money and I saved money. And when I went on to college, I continued that process of saving as much as I could and not using credit cards and not taking out student loans. And it wasn't until my senior year of undergrad that I actually ended up having to take out a small student loan just to cover that last semester of tuition. Yeah. And I was able to pay that off after the first year of working. And then, I got my DPT about 25 years later. So I didn't have to, think about any student debt when I did that. But, times have changed for sure.
Yeah. Well, all right. So let's turn things around a little here. It's not all doom and gloom, right? I preach that, right? If we look at the profession, it's a great profession. I still believe in it. I think, I got into it to help people. I've helped a lot of people. I want to help more people. However, I think it's a great profession if you leverage it appropriately, And what I mean by that is there's so many opportunities to physical therapists based on our skill sets, our knowledge base, our knowledge of the human body and the musculoskeletal system, our organizational skills, our prioritization skills, all these things that we learn throughout grad school have made us into a pretty powerful weapon that we can use to just go into any situation and scenario and make an impact, Yeah. So I think if we make aware, again, right, one of my professors from back in the day is the head of research and development at Nike now. He's a physical therapist, but he's doing research and development. I have another buddy of mine who is big into the tech world. He's a physical therapist, but he's helping with wearables. And he's kind of working on falls and stuff like that, and research with falls for Garmin's and for Apple Watches and for all that to help make those things better. There are other opportunities out there than just your typical 9-to-5 clock in, clock out clinician. And I've been preaching this for a while now. We could do whatever we want. We could make physical therapy whatever we want, which again, like you said earlier, is kind of a good thing and a bad thing because there is so many variables. But because there's so many variables, we also have so many opportunities, So we can use our knowledge and skill set to help people and have a bigger impact by writing, starting a blog, doing a podcast, going into the private sector and doing tech world stuff, going out and teaching, right? Educating. We can go into, academia. It doesn't just have to be in physical therapy. I've seen a lot of PTs teaching in other areas too, especially at undergrad, since they have the doctoral degree. So there's so many opportunities out there. We just need to be open and aware about them. We need to know that they exist. And I think that's one of the ways that we can start, pushing the needle in our favor and making a little bit more money and not having to take those PRN jobs and the moonlighting jobs. But what are some other opportunities that you see that could maybe help sway things our way?
Oh man, the opportunities are endless. When I graduated from PT school, the internet didn't exist. So the opportunities just with technology these days is just endless. A podcast such as this. This is something, 15 years ago didn't exist. And this type of opportunity didn't exist for a physical therapist. And all of the online, online meetings and the ability to meet with folks across the country face to face is just amazing. And the opportunities for web-based visits for physical therapists is growing, and telehealth is
Yeah,
growing.
telehealth.
So those opportunities are going to continue to grow, but we have to make sure that we're being our best advocates for this. Anyone who sits back passively and expects it to just kind of fall in their lap, it is, they need to get involved. They need to be engaged in the profession so that they can be on that leading edge in taking on some of these newer roles. It's we need those pioneers to do these types of things and show, okay, I can do it, so somebody else can do it. And 20 years from now, we're going to have even more opportunities, but we have to show our worth to those that are paying for it, whether it be the insurance providers or the consumer in general. And that's another opportunity, is just consumer education on physical therapy, because it's not out there. Even 30 years after being a physical therapist, I was at a neighborhood block party, and somebody asked me what I did. I said I was a physical therapist. Says, "Oh, you'd give massages all day." I'm like, I haven't given a massage since since I was in PT school.
Right.
So the community at large just does not know what it is that we can do and what we can do for them. And after a 15-minute conversation with this guy, he was actually going to make an appointment to see a physical therapist because he had some back pain. I said, "You don't want to see me, I'm an ICU guy, but I know somebody that can really help you with this." And I set him up, and he's now going to see that physical therapist. So even if it's not something that we can promote ourselves, we can promote our profession.
Yeah.
I think if all physical therapists help promote the profession of physical therapy, man, we're going to be in great shape. We're only going to get reimbursed as a profession based on the outcomes of us all. All right. We can't have a few of us that are having great outcomes. It's not going to change the reimbursement. As a profession, we need to all step forward together. As they say, from womb to tomb, from ICU to outpatient, we all have to, show that our game is on point and that we're progressing patients, through life and through the continuum of care. There's opportunities for us in self-pay for various types of services, and there's a lot of pioneers that have had great success in not just eliminating the insurance providers and providing self-pay physical therapy services, and they're doing very, very well with it, and their patients are very happy, and they're getting word of mouth referrals. And the internet has done huge things for us. Just, you can find anything on the internet. And I think a lot more people are searching the internet for, oh, my back hurts, or my knee hurts, or whatever the case may be. But we need to make sure when they do those searches that they're getting led to good answers and not bad answers. So we have to be involved with technology to be sure that, when a consumer, does a Google search for knee pain, that they're not getting bad advice about physical therapy, they're getting good advice. And, it takes experts to be able to do that are monitoring the net and making sure that their folks are getting pushed in the right direction.
Yeah. So you brought up a lot of good points there. I want to just touch on real quick. One, advocacy, right? Got to advocate for yourself, got to advocate for your patients, got to advocate for your profession. I mean, that's, one of the ways that we're going to get our seat at the table, so to speak, and our opportunities to do these things that are out there, right? Two, when it comes to insurance companies and reimbursement, let's go all the way back to the beginning of the conversation where you're saying, hey, we're going to save you guys a lot of money if you let us do our thing. Like, yeah, you're paying us now up front a good amount, but in the back end, these patients aren't going to stay in the hospital longer. They're not going to have falls and break hips. They're not going to pass away. We're going to have better outcomes, right? The problem is it's so hard to show what you did caused an effect that didn't happen. We're having to show what we do prevents stuff from happening, right? So again, we just kind of have to start looking at like, all right, what were the numbers before physical therapy was instituted? And after they did that, did the numbers improve? So that's a tough one.
Yeah, there's a lot of opportunities for research, and we need that research. We need that evidence to show what it is. It's one thing to go and, yeah, we'll make things better. But if I have, 10, 15 different evidence-based articles that show, all right, this reduced falls by 56% in this group of, older adults living in a social community, that's a huge impact. And that's what's gonna, put the mustard on the hot dog, so to say, to help us move forward with this reimbursement. Just going in and said we make things better isn't gonna help. We're in the same path as a lot of other healthcare providers. We got to come a step above all these other providers that are saying, yeah, we make things better. The massage therapists, the acupuncturists, who don't have this huge amount of debt, but are preaching the kind of the same message that we are. We got to show, all right, we're better, and here's why, and here's the evidence that shows that.
Yeah, and one final thing I want to touch on too that you talked about is a lot of this what we call SEO, right, or search engine optimization. Getting you a physical therapy or a physical therapist to be the answer to, or the solution to people typing in, how do I fix back pain? Who do I go to get back pain taken care of? Whatever it may be. That is going to take a lot of digital marketing. And just now, in the last 5 years or so, I'm seeing more students and physical therapists and PT students getting involved in digital marketing and learning this stuff and learning how to market themselves, learning how to market other businesses, learning how to market clinics, which then helps with SEO, right, and search engine optimization, making sure that your clinic is coming up for your area so people can find you, right? Like you said, that's super important, but it's not something we teach in school. It's not something we learn about. It's just the nature of the beast of nowadays. That's how you have to get seen, is the internet, is technology. So got to be on it. You got to have your finger on the pulse, and you can even make a business out of that. I've known several DPT students that paid their way through school based on having a digital marketing agency where they were able to get clinics, new leads, and new patients coming in the door, and they graduate debt free because of all the hard work they did in marketing and their free time. So again, another opportunity, right?
Yeah. The opportunities are endless. And the other thing you have to think about is these other professions that are trying to get the same piece of the pie that we're shooting after. So if you did a search, say for back pain, not only are they going to get physical therapy, but they're probably also going to get, acupuncturists and chiropractors. And so we also have to show what separates us from these other professions, and I kind of, I use the joke of the old show, Name That Tune. I can fix your back in 6 visits. Well, I can fix your back in 5 visits. And then they'll finally say, well, fix that back. But we have to show that we can do it more efficiently and more effectively. It's all about efficiency and efficacy when it comes to PT practice. And that's the message we have to show. You don't have to go back to, I've been seeing my chiropractor for years. Well, you hear that a lot because, they have to go see their chiropractor for years because that's kind of the nature of the beast. But, if we can get, 5 weeks of visits for a low back pain and they're good to go and not have to come back, that's what's going to, put the proof in the pudding for these insurance providers and have them start reimbursing us at similar or higher levels than some of these other providers that they're already reimbursing for.
Yeah. Well, Jamie, I've really enjoyed this discussion, man. I again, this is a passion of mine. This is something I've been trying to address for years. I think our profession needs it. So any guests we can have come on and any talks we can have about the student loan crisis. And, again, you see a lot in the news nowadays about the government and student loan forgiveness and all that. I'm not going to hold my breath for that. And you shouldn't either. I just, for our audience, just take ownership of it and figure out your own path and your own way to get it done. Because if the government figures it out, great, good for them. We win. But I wouldn't hold my breath on that. So if I could task you with one final approach here, what's like one big takeaway or one big message you'd like to give people with regards to, student loan debt and how to handle it, and what are some ideas? Like, what's the one big thing you'd like to put to our audience?
We have to handle it just like we handle patient treatment. You can't passively sit back and hope that it's going to go away and hope that it's going to solve itself. You need to move to that active range of motion. You need to move to those active exercises, which we all know are going to help improve movement. So if we're going to improve this profession, we need to get active. We need to get off the chair and start getting involved and engaged. And as a group, move the profession forward so that we are getting reimbursed for the services we provide. And we're practicing to the full extent of our license and the full extent of our education. Because in a lot of parts across the country, therapists they paid for this education, but they can't even do everything that they were educated on. So we need to, advocate for that as well. We need to be able to practice with a complete autonomy. That's what we're taught to how to practice, but we still don't have unrestricted direct access across the country. We still aren't seen as primary care providers across the country, and we're certainly not getting reimbursed at that. So for all the therapists out there listening, wait till the podcast is over, then get out of your chair and get involved, get engaged, and let's all move forward together. It's the only way we're going to come out of this hole.
Yeah, I love that, man. Rising tide raises all ships, right? Let's all kind of lift each other up and just figure out ways to get behind it and advocate, and there's more than just one way to advocate. It's not just, about putting on the suit and tie and shaking hands and kissing babies up there in DC. There's a ton of different ways to get involved and support your profession. So hopefully this will, inspire people to get involved in whatever way they feel that they can help out, whatever their strength is. I love that idea of practicing at the top of your license, and practicing, within your zone of genius. That's something I've been leaning into a lot too lately, is use your strengths, whatever you're good at. If you're, good at speaking and talking, go, give speeches, go, start a podcast. If you're good at, making funny films and videos, well, then, all right, TikTok and YouTube are for you. If you're good at writing, well, hey, start a blog, write a book, get out there, get the word, spread the word, do what you can to help out. To make this great profession even better, so I love that, man. I appreciate
absolutely.
All right, well, we have one final question that we ask all of our guests, and that final question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change? How would you change it, and why?
I think, the biggest obstacle to education is the availability of a diverse group of students. As physical therapists, we treat a diverse population. We treat people from all different backgrounds. We don't have that same diversity in the profession. It's gotten a lot better. Don't get me wrong. Things have improved, but we need to figure out a way to have avenues for folks coming from diverse backgrounds, from, underserved areas and minorities and all that, to be able to, become a physical therapist. As we said, the student debt is huge. But if we can kind of decrease those obstacles to allow for a diverse population of professionals, I think it's only going to serve the public better. They may seek out physical therapy care more often because they're seeing folks that look like them when they're or act like them or have the same beliefs and the same backgrounds when they go seek this care. So I think, if I could, if I had that magic wand and wave it, I think, decreasing the amount of barriers to allow for a more diverse profession would be the big thing.
Yeah, absolutely. I think we're seeing more and more now how important diversity and inclusion is, especially from a patient standpoint, right?
Absolutely.
They like the fact that there's, a wide diversity and that they're seeing a therapist that's, from an area that they may be from and can relate to them, and it's so much easier for patients to kind of let their guard down and buy into that patient alliance, that therapeutic alliance, when they know, like, and trust their therapist or their healthcare provider,
Absolutely.
And it's so much easier to know, like, and trust your healthcare provider when you have some commonalities and some things. So, it's diversity, inclusion. It's all so important now, and we're seeing that more and more these days. So I think that's a big one for sure. And like I said, it's gotten better, but we still got a long way to go. We got a lot of work to do. So
absolutely.
Well, Jamie, thank you again so much for your time and for coming on to help chat with us about student loans and some of the things that are coming down the pipeline. Where can people find you or reach out to you if they have further questions or want to follow up with you or just see what you're up to these days?
They can email me. My email is Jamie, Jamie, Dyson, Dyson 224 @gmail.com. And that 224 is my birthday if you want to send me a birthday card.
Nice. good marketing right
there.
Yeah. We'll put that link in the show notes so it's easy for everyone to find you. Thank you again so much, man. I can't thank you enough for your time.
Thank you so much for having me, Scott.